You're about to hear something all new to the world of aesthetic medicine. 5 of the country's most credentialed surgeons, each at the top of their specialty, having the honest conversations that shape exceptional results. This is where surgical expertise meets collaborative excellence. This is Aesthetic Authority.
So today we want to talk about specifically body contouring and body contouring after massive weight loss. Previously, Dr. Heather Lee and I talked about a lot about GLP-1 medication because that's something in all plastic surgery, and especially in our world in plastic surgery, we've been seeing a ton of recently.
So much.
It's just only increasing still, and I think it's going to continue on that trajectory for a while.
Yeah.
So we talked specifically about the medication, but today we really want to delve more into the surgeries that we do after massive weight loss, why we need to do those surgeries, what patients are saying, what patients are coming in for, because one thing we talked about in the previous episode was no matter how you lost the weight, if it was GLP-1s, previous to that bariatric surgery, diet and exercise. I have patients that lose 160 pounds from
That's
just diet
amazing.
and
Yeah.
exercise. However that happens, when you lose at least that 50 plus pounds, you're going to see changes, and there are going to be changes in your skin and how everything looks. And you put in all that work to lose that weight, and you see the scale, the number on the scale, you're happy with that finally.
Yeah.
And you look in the mirror and you feel like nothing's changed.
Yeah.
And I think that's where the consultation with us comes in, but that's what we want to talk about today.
Yeah. I mean, I think sometimes people don't understand that part. Like, I think when doctors talk to patients about weight loss, I don't know that they necessarily get to that point where they're talking about when you lose all this weight, when your skin is deflated, it's going to look like this. And I think for patients who struggle with being overweight, they're just so in their head and self-critical about how they look. And then when they have all that extra skin, whether it's on their belly or their arms or their legs, they're not sure if they still need to lose more weight or if they're at a good point and then what's left is skin. And I think sometimes when they see us for their consult, they kind of come to peace with how much work that they've done and the fact that they can't possibly do anymore, whether it's medical weight loss or surgical weight loss or their diet and exercise. And I think when you tell patients that no matter what else you do at the gym or with your nutrition, this is a surgical problem, I think they have a lot of relief. And they love the consult because it's like, it's really bringing them full circle. And then they're going to be able to look how they are finally feeling on the inside.
Definitely. Some patients come in and they know that they're at their goal weight and that now's the time for surgery for them. But there's plenty of patients that come in because they're like, I did everything I can, whether it's I did every single diet under the sun and exercise. I lost, weight that I wanted to lose, and then it just stalled out. I stalled out on the medications. I had surgery and I lost X amount of weight, and then it stopped. But again, they're seeing this. And patients oftentimes will say this. They'll grab what it bothers them
Is
most.
this fat? That's what they all say. Is this fat?
Exactly.
No, it's skin.
And the vast majority of it is skin. And whatever fat's there, what I tell patients is it's essentially what I call like medically hypometabolic fat.
Yeah.
No matter what you do for weight loss, even if you're on the strongest dose of your GLP-1 or you had bariatric surgery, that fat's not going away.
Yeah.
The only way to get rid of it is surgically remove
Yeah.
it. There's nothing else that's going to help with that. None of these non-invasive things, it's going to be surgery. And people see these changes in specific areas. Not everyone will see it all across their body, but most of the times it's not just in one, it's in multiple areas.
And it depends on your body type and what genetically your body looks like. Did you carry a lot of weight in your lower body? Well, then when you lose the weight, that part was more inflated and it will be more deflated, and you might not have skin that is as rubber bandy and elastic as it was, when we were 20, and you might need skin removal there. And some people really their skin tightens up in certain areas and they don't need certain areas. But that's why these consults are so unique, is because everyone's body is different. Every body type is different. And then, we can really dive into what each of these body parts look like when we address them surgically.
Exactly. And what you said before about the skin itself. So the skin and the biology of everything changes. So when you were at your maximum weight, everything gets stretched out, right? So every layer of the skin, the dermis, the strength layer that you rely on for surgery, that's the one that I always think about. That gets stretched out. So that proteins, the collagen that everyone hears about, elastin, which is another one of these proteins, they get stretched out and they can only handle that stretch for so long. So when you lose the weight and everything otherwise volume deflates, the skin is still like you were, that 300 pounds that you were. And that's part of the struggle. And that's why you're looking in the mirror and seeing what you're seeing, because the skin just is never going to go all the way back.
Yeah.
No matter how gradual the weight is, if you lose 20, 30 pounds, sure. But once you lose more than 50 pounds, and certainly these 100+ pound weight losses, even if you do it very gradually, you're still going to have that issue, because that's just the biology of the skin afterwards.
And that's what we're here for.
Yeah. So we see discrete areas in everybody. And so some patients will walk in and say, it's just my belly that I'm worried about. And some patients will come in and say, it's just my arms that I worry about. And a lot of people will have specific areas, and some people have all of them.
Yes.
So what are the top areas that you see? And then we could kind of get into the weeds of these sort of more unique areas.
I would say the most common is your breast and your belly. Honestly, because you're kind of straight on looking at them all the time. Other things can be like a little bit more hidden, but I would say breast and belly is the number one. And then close behind that, I would say are arms and legs. I would say arms more than legs, because we're probably wearing short sleeve shirts more than we're wearing shorts, maybe especially in Rochester, New York. But arms and then legs. And then I think after that is all the extra skin on the back. So people have extra skin on their upper back and extra skin on their lower back, and we can address those too. And honestly, I think those are surgeries that we're doing more because people are having more complete weight loss with GLPs than they were with other modalities. And I think that they're getting the skin everywhere.
Right.
And so we're kind of, instead of maybe doing one or two areas, I think we're sequentially kind of hitting all the areas in a lot of these patients. But, whatever that combination looks like or whatever the priorities are, they're totally different. I have people who have a lot of belly skin and they're like, it's my arms. I need to do my arms first, and then we can do everything else. So however that combination looks like of, combining one or two of those areas at a time, it's always really unique to just what bothers that patient.
Right. Yeah. And I think that's what a lot of patients will come in saying. Some will say, I have to do this first, and then if we get to everything, and that's great, because what I really care about most is addressing the areas that you care about.
Yes.
Right. These are surgeries to make you feel like that weight loss journey is now complete, and however that looks for you is the way that we should be approaching it. I think there are plenty of patients, just this week that I've seen that say, well, what do you want to do first?
Yeah.
And I have my preferences, but in the end, that doesn't really matter either, because as long as we're staging things safely, and we should talk about the safety component certainly, but as long as we're doing it in a safe manner, I think that whichever order you do, you're going to get a great result, because it's really just optimizing skin removal, and then you're healing afterwards, and then taking on whatever the next thing is.
Yeah. I would say, there are some nuances to body contouring. They're a little different than like our general mommy makeover. There's more skin. So, a tummy tuck is pretty much the same as the tummy tuck that we do if you've had a child and you have extra skin. But usually the weight loss is more, and so there is more skin. And so for surgical safety, that means your incision is probably a little bit longer. Your blood loss might be a little bit more. And so we're going to be a little bit more conservative about combining procedures. But other than, there being more skin, a tummy tuck for a weight loss patient is the same tummy tuck as we do for a mommy makeover.
Right.
So that is a very safe one to combine with one other thing, typically. And I would say the most common combination we see there is breast.
Right.
Essentially, because they're all in the same area. So the healing, is all in the same area. And, how you're restricting your postoperative activity is very similar. And those procedures, I would say, for the most part, are pretty similar to exactly what we do with a mommy makeover.
Yeah. A counterpoint to that, one of the things that we really sometimes lean on for abdominal contouring in the weight loss population is we see where you have extra skin, right?
Yeah.
So in the mommy makeover population, it's almost always just this lower skin.
Yes.
And maybe you had a C-section, you have the shelf over the C-section, and you really just have to take off what's below the belly button. A lot of our weight loss population, they have all this extra skin above the belly button, and it moves in all different directions. So in order to address that, more completely, most of the time, I'm talking to patients that have lost at least 100 pounds of weight about what we call fleur-de-lis
Yeah.
abdominoplasty. So not just a transverse scar, but a vertical scar. So that inverted T. And that could be sort of daunting to patients. But most of the time, once they've gotten there, I just say, your goal, what are your goals for the surgery? I want to remove as much of this extra skin as possible. The only way to do that is through
Yep.
both of those scars.
Yeah.
When I do a fleur-de-lis, I typically don't combine it with the breast. Do you do
Yeah.
that differently?
I do sometimes combine it with the breast. The one nuance to this population that makes it a nice combination, to do is that a lot of these patients also need an upper abdominoplasty or a reverse abdominoplasty. And so if you don't combine it, then you can address the upper skin at the second stage with their breasts. And so, we are talking about this transverse incision, this midline incision, but sometimes these weight loss patients get like a little upper pocket, which is not their breasts, it's under their breast. And so if you don't do their belly and their breasts at the same time, then you can also pull up on the belly skin. So essentially, we're just pulling in multiple directions, which is the one nuance that's different than our mommy patients, is that there is often unique skin pockets in each of these patients. And so the way that we do that combination is a little different.
Right, exactly. And it's not going to be the same for every single person. And so having that consultation, seeing where the weight loss kind of hits you, where you have the extra skin, and might just be above the ribs there, and you just do the reverse abdominoplasty. Most of the time it's going to be in both directions, and then separating those out just to make sure your healing is as good as possible, I think is the right thing to do.
And the one nuance I would say about on the inside too, when our mommies, we always talk about muscle repair. In a weight loss patient, if they've had a child, they probably need that muscle repair. But we have a lot of weight loss patients who are super young and haven't had kids yet. And the one nuance there is usually weight gain from just obesity is gradual. And so their muscles are usually pretty normal. So without the effects of the hormones and that rapid weight gain from the uterus, the muscles are usually more intact if they haven't had kids. And so we get to not worry about repairing that muscle, which for recovery, I think is really helpful for patients. So some little nuances, but in general, procedure is the same. We're just kind of addressing skin and some of the nuances of weight loss a little bit differently.
So we've talked a lot about the bellies, and we've moved up to the breast. But I think, again, a lot of patients see the loose skin in their arms, legs. I think arms, like we talked about, is a lot more common. So talking about the nuances of brachioplasty or arm lift surgery or thighplasty, thigh lift surgery, and how those are different from, say, the abdomen and the breast. What I always talk to patients about, specifically about the arms, because usually that's the next step in this process, is they may have already gone through an abdominoplasty or a breast lift and they scarred pretty well. They have a good high protein diet, so they're doing really well. I talk to them about the expectations for the arms is always going to be different. And that's something that I really lay into, because I think having the proper expectations going into any of these surgeries, but definitely going into sort of the arms and the thighs, is really important, because you may have healed perfectly well. A scar might be a fine line on your belly, but you get to the arms and it's kind of a different ballgame.
Yes. And I tell them, I'm like, we do the exact same thing. We sew it with the same beautiful stitches, and it's small and it's intricate, but arms are just different because they're constantly moving, and the amount of tension on that incision is just completely different than in other parts of your body. So your breast scars might be beautiful, your tummy scars might be beautiful, but that arm scar is probably going to be thicker. And we do everything the same, and we kind of put everything we know about wound healing into it, but it is definitely the trade-off there, is that, yes, the contour is going to be great and you're going to love wearing your short sleeves and your sleeveless, but you will have a scar there that probably won't be as thin as the ones we've had before.
Right. And that's the trade-off for all these surgeries.
Yes.
So the trade-off, you have the loose skin now. How do we get rid of that loose skin? The trade-off is with a scar. And the great things about most of our abdominoplasty, unless we're doing the fleur-de-lis, but most of the breast surgeries, those scars are going to be hidden 99% of the time. We hide the abdominoplasty scar low. Breast scars are hidden under bras, bathing suits. The arm scars, if you're going to wear short sleeves, no matter where you put it on your arm, it's going to be visible. We try to hide it in the most discreet area possible, so that, most people have their arms on their side. So we tend to put it more so in the middle of the arm, sometimes on the back of the arm, but most of the time just trying to hide it any way possible, it's a little bit more visible and it's always a little bit thicker. And so the satisfaction after the arm procedure is a little bit less, and it's all about the scarring.
Yeah.
And as long as you know about that going into it, again, into trade-off, your skin, the skin laxity that you have, like as long as that's one of those things that's really bothering you, I think this is still a great surgery, right? It's a powerful surgery. Nothing else is going to help it. But you just have to know about the scars.
Yeah. It's not going to change your skin texture too, right? I mean, essentially it's just tightening the envelope, tightening the skin, removing the extra skin. But if you have some skin changes or texture changes, which I think we see with maybe GLPs a little bit more than with abdominal surgery for weight loss, the texture is not going to be changed. And sometimes it looks a little good in the beginning because of the swelling. The swelling is deceiving, and it sometimes makes the contour look a little bit nicer. But some of that like skin wrinkling that you have or that crepiness of your skin may still be there.
Right.
We have some modalities that can help tighten and help skin just a little bit, like our helium plasma treatment, but it is not, a magic eraser for the changes of skin that are associated with weight loss. This is really about making the envelope of your skin tighter, but the skin itself is essentially the same.
Right. And I see that on the thighs a lot too, because
Yes.
so many
much
people,
worse.
so many people come in and they say, well, all my loose skin is here, but I hate how the skin looks on the side of your thighs. Can you do something about that? And I can address the loose skin in the middle of the thighs. I think a thigh-plasty is great for that. It cuts down on the rubbing, just the whole overall weight. You can wear shorts. Some people just want to wear like shorts to exercise in, and they just can't fit into anything.
Yeah.
So it improves that so much. It's not really going to do anything to adjust
No.
the outside of the thighs and that
Yeah.
crepiness of the skin.
Gravity is hard, and gravity on the thighs is a lot worse than on the arms. And so patients who have like that crepiness or that loose skin that comes over the top of the knee, we really don't have a great solution for that. I mean, I've had some patients where we directly excise some of the skin around their knee when it's really excessive, but again, that's not going to change the texture.
Right.
And the thigh-plasty that we like to do more often than not is vertical on the inside of the thigh. It's essentially just like the arm lift.
Right.
It's just on the inside of the thigh. And again, it's hidden, but the trade-off is if you wore a short dress or a short skirt, you might see that incision as it comes to the knee. So again, it's a trade-off of a scar. I actually think the thighs heal a little bit better than the arms, even though it's still like in motion and it's, logistically kind of a hard area for recovery. It tends to be a little bit of a finer line than the arms.
Yeah, I don't see them quite as thick.
Yes.
I think where you have the extra skin is still a targeted approach for the thighs too. Some people just have the crescent kind of up in your groin, and you can make that a little bit more discreet. But most of the time, especially in a weight loss, that skin's going all the way down to just above your knee. And so I show patients, does this skin down here bother you? If yes, then you have to have an incision there. And so it's going to be the extent that it needs to be in order to address it. Otherwise, there's not really a huge point in doing it. So I think there is sort of gender differences that we see in the weight loss population. I am seeing, a lot of male patients who lost weight on GLP-1s. They do tend to be younger, I feel like, in a lot of cases. And so there are guys that not only are they taking GLP-1s, but they're in the gym constantly. And so,
which is nice to see.
Which is awesome. Yeah. And that's part of it is, it's the medication gets you, again, the result on the scale that you want, but then finding the other lifestyle things that help you stay healthy afterwards. Because most people don't even want to be on that forever. Or even if you are, you're kind of doing a microdosing thing or like just maintenance dose, but it's everything else that you do that, honestly, for whatever reason, this medication also seems to help you gets you to maintain that over time. In guys, I feel like that's even more powerful because what I see most of the time is guys are coming in, they're really only talking about their abdomen and their chest. Their arms and their thighs don't bother them because
Honestly,
they're bulked up.
And their skin is better.
We're lucky.
Guys have better dermis. It's just, it's just a reality. You have thicker dermis. And I think that extra elastin is honestly really helpful. So that skin tends to rebound better in arms and legs. And then you don't have all that crepiness and the cellulite. And so I agree. Arms and legs are more forgiving, and guys are very like chest and torso focused.
Right. Yeah. And so for the abdomen, scar length is about the same, but everything else about the procedure, the vector that we're kind of pulling things
Yes.
in, whether we add lipo, it's a lot more nuanced because
Yes.
the goal is, keep a masculine form.
Yes.
We're so used to doing the mommy makeover, tummy tuck,
Yeah.
and that's what you see a lot of on like social media and stuff. And it's a little bit different because, that's trying to restore a feminine form, and there are these nuances between it. So although we'll talk about the same scar, how I'm pulling things in the operating room, where my sutures on the inside go to sort of define things a little bit more. Those are all a little bit different, guys, because I don't want to feminize the
Yeah.
abdomen. And I think the chest is a complete different story,
Yes.
obviously, because we're not doing a mastopexy. So now we're talking about kind of the gynecomastia side of the
Yes.
weight loss story. And everyone, again, has a little bit of a difference
Yes. We see such a
here.
range.
And some of it is still some profound volume that for whatever reason the weight loss didn't touch. And so there could be a liposuction component of this a lot of times. And if you don't have the skin laxity there, then great. You could just do liposuction, sort of a minimally invasive approach, maybe adding on that helium plasma, the Renuvion, just to help. But a lot of times, again, with the weight loss population, we need to do more.
Yeah.
And so gynecomastia surgery for that patient population often involves incisions, which
Yeah.
most of the time I try to stay away from, but a lot of times you can't.
Yeah.
And that's really trying to flatten the chest and getting you back. Again, these guys are in the gym, so they have great pec tone, but we want to get that to show through, and we're trying to hide our incision sort of in the shadow of the pec. And so it's very different surgery than sort of the female side. Not as worried about like nipple sensation, right?
Yes.
So you
Yes.
can have more freedom to reposition that and put it back on as a graft and get it to the size that we want and the location that we want. And so again, a lot more nuances of it, but certainly the front portion of the abdomen, the chest is pretty much all I talk to guys about for the most part.
Yeah, and I think the recovery from all those things is a little bit different too. Like there's definitely some guys who want gynecomastia surgery and they don't want the downtime, and those are great patients to try, liposuction alone on or liposuction with helium plasma, because we can try to do it without incisions, which means your downtime is a lot less and you can get back to the gym. And I love when they're like on that trajectory and they don't want the time out of the gym. And then we can always come back and take skin out later. But when you've had weight loss surgery, sometimes you just really need that extra incision for your gynecomastia. So it's just a little bit different than a general gynecomastia population.
Definitely. So getting a little bit back towards the safety component of these operations, because when you're coming to the office, I'm always going to say, our safety is our number one goal for you. I want you to get that optimal outcome, the outcome you want, but safety is really important. And part of the safety thing and getting that optimal outcome is making sure that you're in the right time to have this surgery.
Yes.
So, there are people that still come in and say, I am well on my journey. I still have 50 pounds to go, but, I know if I get the surgery, it's going to get me there. Or with that surgery, you're going to be removing 50 pounds, right? So those are difficult discussions to have because that's not the case.
Yeah. Yeah, you really want to be pretty darn close to your goal weight. I would say like within 10 pounds-ish, 15 pounds is not going to make or break really the skin contouring thing. And so, and you don't want to just like hit that number. You want to be hit that number and be honestly in a steady plateaued state. And that just shows that, things have stabilized. You never really want to operate on a moving target. And I think that's an easy thing for the patient to understand. You want to make sure that they've gotten where they're going to be and that you can make them as tight and as feminine or as tight and as masculine as they want to be at that goal weight. And then if there's weight loss after that, then that really affects their result, and you really want them to protect that investment. And I think when you explain it in that way, people absolutely understand.
Oh, for sure. So it's all about what our shared interests are. You are putting in the time, the money to have this surgery done. You want the best outcome possible. You didn't take shortcuts to get the weight loss. And I know this is sort of that last step, but don't take shortcuts here either.
Yeah.
So that 6 months of weight stability proves to you as a patient that, you can do this, whether you're on getting off the medication completely and you're doing diet and exercise, or, you're doing like a maintenance dose or whatever that is, whatever your long-term goal is. It shows us too that you're you're kind of stable. And I think that's important as building that trust relationship. But like either direction, you don't want to be going up after surgery either, because you're
Yes.
not going to be happy with their outcome either. So
Yeah.
just
It's disappointing.
within 10 to 15 pounds, I think, is our goal. And then from a separation of procedures, I still use sort of a 6-month time frame
Yeah.
too, because again, we're not going to do more than like 5.5 hours of surgery at once in one setting. So we can combine like 2 of these areas. But usually there's more that patients want done. They say, all right, when can I sign
Yes.
up now for the next
Yes.
one in a couple of weeks? And no, I think you need the time for your body to heal. There's so much protein that goes into the healing process. Your diet has to be high protein, 150 grams of protein a day. I harp on that too.
Same.
And
Nutrition and
thankfully,
exercise.
thankfully, most of these people are already doing that.
Yeah.
But that's something that, is necessary in order to heal. And then giving you the time, because if you jump too early and do another sort of hit on the body, it can only take so much. And then that's when you start seeing issues.
Yeah, I think if they're optimized nutrition and exercise, it really helps recovery.
Yeah.
We know that the protein is helpful for wound healing, but there's something about the exercise that they just have that stamina that surgery doesn't really, knock them off their feet. It really, they treat it just like they would their training.
Yeah.
And I think that a lot of the time our weight loss patients are already optimized there.
Yeah.
They already know that, especially the GLP patients, that they need to be weight training so they don't have muscle wasting, and they need to optimize their protein because of that caloric deficit. And so I think when patients are optimized nutrition, diet, and weight, then they're really set up for success.
Definitely. And I think we see almost a wider age range of patients now than
Yes.
ever before. Because it used to be, you have bariatric surgery in your 30s or 40s,
Right.
and we're seeing you late 40s for these surgeries. Now, especially with the GLP-1s, we're seeing patients in like 20,
Yes,
21.
very young adults. Yeah.
And that spread has just increased. And I don't think that's, I think if anything, that's a good thing, right? So getting to that lower weight earlier on, most of these, and I don't want to say that everyone that's losing weight is doing it just so that way they could have surgery and look better, right? There's so many health benefits.
Oh
and
my gosh.
that's, for your long-term health, that's the most
Yes,
important thing.
especially,
This is sort of the side thing to get you to that final result in the mirror, but the health stuff is super important. And getting to that when you're 20 versus waiting a decade or so,
Right,
and all the
wow.
cardiovascular and the diabetes and everything like that, like all the better for all
Yeah.
these patients. And so when you hit that goal weight, it's not too soon. As long as you're proving that you're stable, you could do it when you're 20, and then you'll just have a longer time with these results. If you do it when you're 50, it's not too late. I think as long as your health is good and as long as you're at your goal weight and stable at that goal weight, I think we could have a good discussion about what surgery would look like.
I think a common question that younger women ask is it silly to get this weight loss surgery now if I'm in my 20s and I haven't had kids yet? And I don't think it is at all. I have lots of young women who haven't had families yet, aren't in a relationship, but they've done all the work to lose the weight and they want to feel and look their best. And, that's the time in our life that we do want to feel and look our best. And so I think it's absolutely okay for women to have weight loss surgery before they have kids.
Yeah.
And, we just do things a little bit differently with their bellies. We're not going to tighten those muscles because they don't even really need it.
Yeah.
But it's absolutely a reasonable thing to do. You still might need, something or want something after you have kiddos, and
Right.
that's fine too. Then you're just, setting back the clock and starting, to enter that stage of your life in a healthy place and with a body that really reflects how healthy you are.
Exactly. So similar to a lot of our surgery, like I hear this a lot for like breast reductions and my older ladies that are getting breast reductions, but for this surgery also, I hear a lot about, man, I wish I had done this sooner.
Yeah.
And some people have lost the weight and just been dealing with the skin for a while. And they just didn't think they thought this is too vain, or, I'm healthier, like my diabetes is gone or under control. And so what's the point? And then it just kind of wears on them over time. And then I have one patient in my mind that, lost, I think, 160 pounds and primarily diet and exercise over the course of a couple of years. So all that hard work. And now we're, 3 stages in from a surgical perspective, and they're feeling amazing. And that was the first thing I feel like they said is, I wish I had done this sooner. And happy to talk about that experience. But it's something that you do feel better. You already feel better from a health perspective after weight loss, but psychologically you feel better after these surgery. There's a lot of that component that you can wear the clothes that you want to wear, the size that you feel like you should be in, you're finally in because that loose skin and the abdomen's gone. Bathing suits, all the things that you thought, okay, I lose the weight and now I can do these things. They weren't a reality, but then after the surgeries, they finally are.
Yeah. When they look in the mirror, in their clothes and out of their clothes, I think it's really different. I have a really young patient and her face, has tightened up despite like over 100 pounds of weight loss. And she looks just so young and beautiful. And then when she looks at the rest of her body, it just doesn't feel like it matches. And, step by step, we've kind of gone through and done breasts and belly and arms and legs. And, every step of the way, I think that they kind of come to feel like themselves even more, especially the young people. Like they deserve to look in the mirror and feel incredible and to feel really proud of all the hard work they've done, no matter how they've lost the weight. And it's so nice to see that transformation in these patients. They're just like living life and not thinking about their weight or their skin or the clothes that they have to wear to cover things up. They're just living. And it's really amazing to see.
Definitely like a sappy moment, but like this is the sort of stuff that drew me to plastic surgery to begin with is, and there's subtle changes we can make as plastic surgeons. These are not subtle changes.
No.
I love the on the table results after removing all this, like the skin and for abdominoplasty, one of my favorite operations, but all these, it's just so dramatic that, you finish and you're like, wow.
Yeah.
That really made a difference.
And then they look at themselves and they say the same thing.
Yeah, exactly.
They're just in awe, or there's tears, and it's honestly the most rewarding thing to do.
Definitely.
I think the most important thing for these patients to remember is that they did the hard work, and they really deserve this. They deserve to look in the mirror and see their hard work. And sometimes that skin is sort of blinding them to actually see the hard work that they've done. And when you show them the contour underneath, which is their hard work, we get rid of the skin and the abs that are there and that tiny little body. That's all their hard work. And I think it's just extremely rewarding for this population. And I just love seeing these transformations.
Definitely. And I'd say that at every single consult, like there are plenty of people that rightfully are, worried about surgery, worried about the recovery. You did the hard part already. You spent the years that it took to get to where you are now. And you're in the office because you're not seeing what you want to see. You deserve to see what you want to see. We talked about the biology of the skin. Yes, we're not going to change that. We're not going to change sort of the crepiness, but like you can get the look that you want under clothes. You can be able to wear that bathing suit that you want to wear and not have loose skin hanging over it. You can do all these things and you should be able to. And that's what we're here to help you with. So it's again, one of the more rewarding patient populations, I think, to work with. And it's a journey, again, it's usually not one stage. So we're seeing these patients for years.
We get to know them very well.
Which is also nice for us as surgeons.
Yeah. So for all these weight loss patients out there who are at home, putting on clothes, looking in the mirror and just not happy, I mean, just come in and talk to us because everyone's body is different. What you're left with is different. You've done the hard work. What we do in the operating room only takes a few hours. What you've done took years. And, let's have a talk about what's meeting your goals, what's not, and make a very personalized plan that works for you. And truly, these patients are just so overwhelmingly happy, and the change to their life is really palpable. And we are just so excited to get to know them, to meet them, to spend all that time with them, working through this, stage after stage. And if you're thinking about it and you've done the hard work, come and see us and we'll tell you, how we make you feel, on the outside the way you feel on the inside.
Yeah. You've been on this journey for years. We'll help you get to the end of the journey. So this is the finish line. Let us help you get there.